After primary prostate radiotherapy, approximately 10% experience a localized recurrence to the prostate. The role of MRI and MRI-targeted biopsies for detecting intraprostatic cancer recurrence and planning for salvage focal ablation is unclear. To study this, the authors performed a secondary analysis of the Forecast trial, a UK-based prospective cohort study in patients with suspected radiorecurrence. 144 of these patients were included in the secondary analysis. All patients underwent MRI with transperineal template mapping biopsies, and 84 had additional MRI-targeted biopsies. The primary objective was assessing MRI diagnostic accuracy. Second, the pathological characteristics of MRI-detected and undetected tumors were compared. Third, 4 biopsy strategies involving MRI-targeted biopsy alone and with systematic biopsies were studied to identify the best strategy. Last, eligibility for focal therapy was evaluated for men with localized radiorecurrent disease. Multiparametric MRI sensitivity and specificity at a patient level were 95 and 21% respectively. However, at a prostate quadrant level, sensitivity and specificity were modest at 66 and 54%. Compared to MRI undetected tumors, MRI detected tumors had a longer maximum cancer core length and a higher grade group. Of the 84 men who also underwent MRI-targeted biopsy, 87% had recurrent cancer diagnosed. Performing MRI-targeted biopsy alone missed cancer in 7% of patients. With additional systematic perilesional sampling using the fourth strategy, cancer missed went down by approximately 50%. At a regional level, if MRI-targeted biopsy alone was performed, 59% of patients with cancer would have harbored undetected additional tumors in unsampled quadrants. Using the fourth strategy would have reduced this to 10%. Overall, 59% of patients with localized radiorecurrent cancer were suitable for a form of focal ablation. To conclude, MRI is accurate for detecting recurrent prostate cancer. However, if focal ablation is planned, MRI-targeted biopsy alone is insufficient, as 3 out of 5 patients harbored further tumors in unsampled quadrants. Hence, systematic sampling of the whole gland should be considered in addition to MRI-targeted biopsy to capture both MRI-detected and undetected disease.